The National Oceanic and Atmospheric Administration published a study in PLOS One in 2015 that links the dramatic increase in dolphin death to the Deepwater Horizon oil leak. A research team reported on 12 April 2016 that 88% of the 360 baby dolphins or stillborns in the spill zone had abnormal or subdeveloped lungs, as compared to only 15% in other areas. The study was published by Diseases of Aquatic Organisms in April 2016. Health Effects article, Deepwater Horizon Oil Spill Health Effects. In June 2010, the Louisiana Department of Health and Hospitals had received 143 spill exposure reports. 108 of these cases involved workers who were cleaning up the spill, and 35 of them were reported by local residents. The oil and dispersant chemicals are thought to be responsible. It is also believed that adding dispersants to the oil made it more toxic. On Elmer's Island, just west of Grand Isle in Louisiana, a worker cleans up oily debris, the 21st of May 2010. In response to these reports, the United States Department of Health and Human Services established the Gulf Study in June 2010. The National Institute of Environmental Health Sciences is running the study, which will last for at least 5 years. Workers hired by BP clean oil from a beach at Port Fourchon in Louisiana on the 23rd of May 2010. Mike Roberchet, a Louisiana doctor, described the situation in this country as the largest public health crisis resulting from chemical poisoning. Wilma Supra, an environmental scientist, said in July that she found amounts of volatile organic compounds 5 to 10 times higher than the 95th percentile in the blood of BP workers and residents of Louisiana, Mississippi, Alabama and Florida. She said the presence of these chemicals is a sign of exposure. Riki Ott is a marine toxicologist who has experience with the Exxon Valdez spill. She advised families to leave the Gulf. She stated that the workers who were affected by the Valdez oil spill suffered long-term effects. BP, following the hospitalization on 26 May 2010 of 7 fishermen who were part of the cleanup crew, requested that the National Institute for Occupational Safety and Health conduct a health hazard evaluation. BP requested a second NIOSH inspection of the onshore cleanup operations. The tests for chemical exposure were negative in 7 of the fishermen. NIOSH concluded the hospitalizations most likely resulted from heat, fatigue and the terpenes used to clean decks. The review of 10 hospitalizations later found that dehydration and heat exposure were consistent findings, but it was not possible to establish chemical exposure. NIOSH personnel monitored the air around cleanup workers on land, at sea and when Corexit was applied. The concentrations of volatile compounds and PAHs in the air never exceeded acceptable exposure levels. Their methodology had a limitation in that some VOCs could have evaporated before they started their investigation. In their report they suggested that respiratory symptoms could have been caused from high levels of reactive aldehydes or ozone in the air. These may have resulted from photochemical reactions within the oil. NIOSH noted that some personnel were not wearing personal protective equipment, such as gloves and impermeable coveralls. They stressed that this is important to protect against transdermal absorption of chemicals in the oil. Heat stress was deemed to be the greatest safety concern. Workers claimed that respirators were not permitted and that their job would be threatened if used. OSHA stated that cleanup workers receive minimal exposure to airborne toxins. OSHA requires BP to provide certain protective apparel, but not respiratory masks. ProPublica reported workers being photographed without protective clothing. Newsweek conducted an independent investigation that revealed BP failed to provide the Corexit safety manual, nor did they provide safety training or protective equipment. In a 2012 survey, workers who were cleaning up the spill reported eye, nose, and throat irritations, respiratory problems, bloody urine, vomiting, and rectal bleeding, seizures, nausea, and violent vomiting that lasted for hours. Skin inflammation, lesions, and burning, short-term confusion and memory loss, liver and kidney damages, central nervous system and nervous damage, hypertension, and miscarriages. In an article for the American Journal of Disaster Medicine by Dr. James Diaz, he said that the ailments reported in the Gulf were similar to those after other oil spills like the Exxon Valdez. Diaz warned, chronic adverse effects on health, such as cancers, liver, kidney and mental disorders, birth defects, and developmental disorders, should be expected among vulnerable populations and those who are most exposed. Diaz believes that neurological disorders are also to be expected. A study conducted by the National Institute for Occupational Safety and Health 2 years after the spill found biomarkers that matched the oil in the spill on the bodies of cleanup crews. Other studies reported mental health problems, skin issues, breathing issues and headaches. During the Gulf of Mexico Oil Spill and Ecosystem Science Conference, in 2013, findings were discussed that a significant percentage of Gulf residents reported mental health issues like anxiety, depression, and PTSD. The studies showed that former cleanup workers' bodies carried biomarkers for many of the chemicals in the oil. In a study of children living in Louisiana and Florida less than 10 miles away from the coast, more than one-third of parents reported symptoms related to their child's physical or mental health. According to David Abramson of Columbia University's National Center for Disaster Preparedness, parents reported unexplained symptoms in their children. These included bleeding ears, nosebleeds and early menstruation for girls. A cohort study of almost 2,200 Louisiana women found high physical environmental exposure was significantly associated with all 13 of the physical health symptoms surveyed, with the strongest associations for burning in nose, throat or lungs, sore throat, dizziness and wheezing. Women who experienced a high level of economic disruption due to a spill were more likely than others to experience wheezing, headaches, watery, burning eyes, and itchy noses. Sign warning against swimming in Orange Beach, Alabama due to oil spill. The spill was a major economic blow to BP, as well as the Gulf Coast economy sectors like offshore drilling and fishing. The Gulf Coast economy was projected to lose up to $22.7 billion in lost tourism dollars by 2013. Louisiana also reported that visitor spending losses from 2010 to the end totaled $30 million. Losses through 2013 are expected to reach $153 million. Gulf of Mexico's commercial fishing industry lost an estimated $247 million due to the closure of fisheries following spills. A study estimates that the total impact of the lost or degraded recreational, commercial and mariculture fishing in the Gulf by 2020 could be $8.7 billion, with a potential loss of 22,000.